Good evening, dear viewers, and welcome to a new episode of Medical Talk, your trusted weekly program for health awareness and medical education. Today's topic is one of the most common causes of back pain worldwide, the herniated disc. From sharp lower back pain to numbness, tingling, and difficulty standing or walking, disc problems can significantly affect daily life. Modern lifestyle habits like prolonged sitting, poor posture, and lack of physical activities have increased the prevalence of herniated discs among young and older individuals alike. Understanding how a disc herniates, how it affects the nerves, and the latest methods of treatment is crucial for both prevention and recovery. To guide us through this essential topic, we are honored to welcome Dr. Mohammad Alfeeli, specialist orthopedic and spinal surgeon. With his expertise, we will explore the causes, symptoms, diagnosis, and both conservative and surgical approaches to treating herniated disc. Stay tuned, you're watching Medical Talk. Welcome back. We're happy to have with us in the studio Dr. Mohammad Alfeeli, a specialist orthopedic and spinal surgeon. Dr. Mohammad, welcome to Medical Talk.
Thank you for having me.
Thank you so much. Today's topic is very interesting and very common. I would say we need to dive in first with the basics. What exactly is herniated disc and how does it develop?
So, to explain what is herniated disc, we need to understand what is a disc first.
Exactly.
So, if we want to know what is a disc, I got a model of a normal spine.
Yep.
And this is a piece of the lumbar spine where we can see the vertebral bodies. And in between the vertebral bodies, we see this structure, a soft structure, which is called the intervertebral disc, i.e. that it is between vertebral bodies. And this model here, I can show you how does the intervertebral disc looks like.
From the inside, basically.
From the inside. Yeah. So it looks like a structure with an outer fibrous layer and an inner gel-like layer, which is rich in collagen, chondroitin, MSMs, and type 2 collagen for the inner part, type 1 collagen for the outer part. When a herniated disc happens, it happens because the outer layer, which is the fibrous layer, dries up and it cracks. And the axial loading on the discs pushes the gel out into the spinal canal.
So it's basically like encapsulated.
Yeah, it is encapsulated. Yeah. It's an outer fibrous layer and an inner gel-like layer.
In central.
Yeah, in the center. And a fracture happens in the outer layer here. And the axial load, when we load the discs like that on standing or sitting down, it pushes the inner gel-like layer outside into the spinal canal, which presses on the nerves. And that causes the back pain and the sciatica.
So basically it's like a bulge.
Yeah.
Yes. Okay, so many people experience back pain, but they don't realize it might be disc related. What are the most common symptoms of herniated disc?
So back pain is an interesting topic here.
It's a very wide...
and I'd like to highlight, I'd like to stop here and take some time from your precious time to differentiate between back pain and disc.
Exactly.
Back pain is the commonest pain ever. Almost everyone in their lifetime would experience back pain. However, 90% of the back pain is not disc related. It's mostly muscle related or joint related, or it's idiopathic, where we cannot know what's the cause of the pain. What is related to the disc is when the disc is pressing on the nerves that innervate the back muscles and the joints. Here where we have the pain. Other than that is purely muscular pain or joint pain or as I said, it can be idiopathic pain. So in contrast, disc pain is usually transmitted to the nerves where the disc is feeding. So is the common understanding that the disc would affect the legs, but that's not always the case.
Exactly.
Because our spine runs from the neck all the way down to the lower back. We can have disc at any region of these. We can have it in our necks. And if it is in the neck, it would affect the upper limbs mainly. It can affect our gait, can affect our hands function. If it was in the thoracic region, in the chest, it would affect our ability to walk. It might affect our ability to control our bladder. If it was lower in the spine, i.e. in the lumbar spine, here it might affect it can cause leg pain, and can affect our legs strength as well.
Exactly. So how does poor posture, basically prolonged sitting and improper lifting of things contributes to disc herniation?
So before I answer that, we should understand the basic anatomy of the disc.
Yes.
So the disc is composed mainly of water and some proteins and proteoglycans, which I highlighted earlier. And as we age, we tend to lose more of the water content, which makes the disc stiffer. And when the disc is stiffer, it's liable to have the fracture of the outer layer. So what you mentioned about prolonged sitting, improper muscle balance, this will increase the load on the intervertebral discs, because the paraspinal muscles, if we sit for long times, if we're not active, they'll become weaker. If they are weaker, the weight they were holding will be transmitted into the joints and ultimately the discs. So that weight, which was supported by the muscles themselves, now the muscles have become underwent fatty degeneration, and they become much weaker to hold the spine. Hence, the weight of the spine is being transmitted from the muscles here on the back to the joints, the facet joints of the spine, and the intervertebral discs. And the discs are not designed to withhold all of that weight. Therefore, under the continuous tension and pressure from the weight of the body, which is with the high body weight, the high body mass index, with obesity, with lack of exercise, which leads to fracture of the nuclear, the annular of the disc, and protrusion of the nucleus pulposus, which is the disc, the jelly part of the disc, into the canal.
So basically, if sitting improperly or lifting something, it's not the fact that sitting or lifting something. It's basically the strength of the muscles that support the spine.
Yes. Okay. So it's mostly the strength of the muscle, and this is why you see some bodybuilders, they can lift 100 kilograms or even 200 kilograms, and they don't suffer from disc.
Yes, exactly.
So it's not merely because of the disc. So it's a combination of factors. Is your hydration level, your muscle mass, and your muscle strength as well. It's not only the muscle mass, but the muscle mass combined with the muscle strength itself.
Exactly.
This all plays an important role in maintaining a healthy disc. Poor posture, because it increases the load on the disc, because the improper posture will increase the axial load. We can see this clearly in the neck. If we're holding our head straight, usually the head weighs around 5 kilograms. So that 5 kilograms is directly loaded to the cervical spine. However, if we improperly, especially with the new advancements of smartphones, everyone's looking at his smartphone, the down tilt of the head by 15 degrees, which some people say is nothing.
Yeah.
This will increase the load on your cervical spine by 100%.
Wow. So you're basically carrying 10 kilograms
instead of 5. Imagine that when somebody tilts his neck or he's looking downwards by 60 degrees, almost a chin on the chest, that can increase the load on the spine to 500% to around 27 kilograms. So instead of holding 5 kilograms on the cervical spine, you're loading to 27 kilograms. It's not designed to hold all of that.
Exactly.
And along with the muscle weakness of the lack of exercise of the neck muscles, that will increase the load and lead to cervical disc herniation.
Absolutely. So this is very interesting information. We have more questions, but we have to take a short break. We'll be right back. Stay with us. Welcome back. We're still talking in the studio to Dr. Mohammad Alfeeli. Dr. Mohammad, before the break, we were talking about the herniated disc. Now my question is to you, is it MRI or CT scan to diagnose, or how do you diagnose herniated disc?
So this is an interesting question. So most people, when they walk into the clinic, doctor, I have my MRI. So, what do I do with your MRI? I need to hear your story first. So we go back to the basic of medicine when we go to medical school. Is history, examination. Then you go for your investigations. And why is that? There's a reason behind that. Because if you go to your MRI and you find a herniated disc on your MRI, but the patient is symptomless, I will not do anything for that guy. So it depends really on the presentation of the patient. And sometimes you can find a disc on the MRI that is herniated to the left side, and the patient is complaining of right-sided pain, which does not correspond to his MRI finding. Operating on that guy will do him no good at all. So it really, if you're a good clinician, you should be a good historian. And a good historian should combine his history-taking skills with a good examination skills. After that, he should order the proper investigation. CT versus MRI. CT is designed to show us the bony structure of the spine, while MRI is designed to show us the water content, i.e. the soft tissue, the discs, the muscles, the nerves, blood vessels. So to diagnose a herniated disc, the golden standard would be MRI after a proper history and examination, which is the basic of diagnosing a disc. I can diagnose a patient who has lumbar canal stenosis and a possible disc without having an MRI, merely by a history and physical examination. The MRI is to confirm my finding. It's not to find something that I don't know.
Exactly. So basically, the good medical history and a clinical examination, then we move on to the MRI, not the CT scan. It's not the other way around. Now, when should a patient seek medical attention instead of managing the pain at home? Because as you know, so a lot of people, they try to manage their back pain at home.
So this is a good question, because managing back pain at home sometimes can involve wrong practices. So I'll advise to seek medical attention, or at least an expert advice early on, so that we don't complicate the problem. Because if we start with a simple problem that can be treated with some medications or physiotherapy, but we want to undo all the wrong stuff, then we might need something which is more extensive and more invasive. We might need surgery to correct what you've done wrong. Most of the disc, like 75 to 80% of disc patients which present with sciatica, can be treated conservatively with physiotherapy, pain medication, because our bodies are designed to deal with that, and they resorb the disc back within 3 months. So if you see a patient with a disc and some sciatica pain, that pain is tolerable for him, I'll tell him, come to me, I'll see you in the clinic in a few weeks' time. And when I see him in a few weeks' time with physiotherapy, painkillers, he'll be fine. He doesn't need any intervention. However, in a small minority, where the pain is persistent or is intolerable, or he presents with a weakness to one of his limbs, or to loss of control of the bladder or the bowel, he'll need urgent surgery. And the sooner the surgery, the better the outcome. Because sometimes if the pain is beyond tolerance, and I'll tell the patient, no, I'll withhold it for you for a few months, then I'll reassess. Nerve damage is irreversible here. So early surgery might be a good option for the right patient, but it might be the most devastating outcome if you elect to do surgery in a patient who did not need surgery at the first instance. So it's really a fine balance between the need and the doing of surgery.
Yes, exactly. Now, and what are the latest advancements in the treatment of basically herniated disc, including the minimally invasive spine procedures?
So if we go back in the days, back in the 80s and early 90s, it was done all in an open fashion, a big incision to get the disc out.
Yeah.
Now with a microscope, we minimize our incision to around 2 centimeters. And with the new introduction of endoscopy, which can be used in selected patients, we minimize that incision to around 8 millimeters. And most importantly than the skin incision is the minimal violation of muscular sleeve of the paraspinal muscles, because this plays an important role in stabilization and carrying the weight of the spine, as we mentioned earlier. And open surgery or extensive surgery would leave those muscles in almost paralysis because of the fibrosis they undergo post-operatively.
And the post-op, basically recovery, how long does it take?
So this is an interesting question, and it's really misunderstood here. So most of the spine patients would move on day 0.
Oh, same day?
Same day. Actually, most of our patients were discharged same day.
Wow,
when I was doing my training.
Yeah.
Especially if you're doing only microdiscectomy.
Yeah.
Most of the patients would go home second day to day 1 after procedure. They get admitted to the hospital, they have their procedures, second day they're off home.
Yeah, but they're not going back to work completely.
Well, that's another question now.
Yeah. Depends on what the type of job they have.
What are the post-op precautions?
Yeah.
So that's another question.
Yes.
Are there post-op precautions? Yes, there are. Because when you do the microdiscectomy, you still leave the fissure where the disc herniated. So there will be at a higher risk of having re-herniation of the disc, because we do not remove the whole disc. If we remove the whole disc, we leave an empty space where we increase the liability of back pain. Only 10% of patients who undergo microdiscectomy will have reherniation, and they might need reoperation. This number does not, so you basically tell them, take the first few weeks easy, don't carry heavy weights, don't bend forward, and don't do rotation.
For how long?
For only 3 to 4 weeks.
That's it?
Yeah.
Okay.
Then they do phased return to work, and by the 3 months benchmark, they'll be as they didn't have any operation at all.
What about the post-op pain?
It's minimal, imagine. You can control it with paracetamol and ibuprofen.
Simple.
Yeah.
Yeah. And in terms of the ability to do daily tasks, like, for example, going to the toilet or...
So, toilet, going up the stairs, down the stairs, walking is all doable day 0.
Okay, so there's no problem with that?
No. So it's only the impact, what we advise against, the impact and the heavy lifting. So no running, no heavy lifting.
Well, that's easy.
No forward bending.
I think that's manageable.
Yeah.
And if there is one last advice you would give to our viewers to avoid herniated disc, what would it be?
So keep active, keep hydrated, do exercise, please.
Very simple.
Yeah.
And as an early age, basically.
Yeah. And
keep
keep it till later in life.
Yeah.
And stop smoking.
Start early and keep it, yeah, and stop smoking. Dr. Mohammad Alfeeli, thank you so much for your time. And
it's my pleasure.
And we've learned a lot from you. I learned a lot from you because from my line of work, as you mentioned, I'm a dentist and I'm prone to herniated disc, but now I know what to do. Thank you so much, and hopefully we'll be able to host you again in Medical Talk.
Thank you.
Thank you so much. Dear viewers, we still have more to go. Stay with us, we'll be right back. Maintaining good family health starts with daily habits. Encourage everyone to stay active through walks, stretching, or light exercises, and make sure meals are balanced with plenty of fruits and vegetables, whole grains, and lean protein. Drinking enough water, getting regular sleep, and protecting good posture are also key for overall well-being. Limiting screen time, balancing devices with outdoor physical activities, and keeping up with regular health checkups prevent long-term issues. Equally important is mental wellness. Encouraging open conversation, relaxation, and stress management supports a healthy, happy family life.
Hello, this is Mahmoud Abu Nasr, an exercise therapist from Fawzia Sultan Physical Therapy Center. Today we're going to talk about the perfect ergonomic desk setup to avoid neck and back pain. So number one, avoid posterior pelvic sag because it's number one cause of lower back pain. And instead of here, you have to sit upright here. To fix this, try to sit as far back in your chair as you can, so the chair's back sit supports the pelvis at your belt level. So for reaching out for the keyboard and mouse, make sure it's close, so your forearm rests on the desk and your elbows are in your side. Reaching out for the mouse and keyboard, make sure it's close to the desk, so you're resting your forearm and your elbows by your sides. Avoid extending your knees or flexing. Okay. Avoid extending your knees or flexing your knees, so make sure your heels are on the ground, so your knee at 90 degrees. Make sure the back of your knees don't touch the back rest of the chair, and if they do touch the back of chair rest, you need to change it. Make sure the screen is at your fingertip distance. In conclusion, try to have a break, like in between each 30 minutes, to have a walk and stretch while sitting. By extending your knees, reach overhead and outside to your body.
As we wrap up today's episode, we remind you that protecting your spine begins with daily habits, proper posture, regular movement, and early medical evaluation when symptoms appear. A healthy spine supports a healthy life. Thank you for watching Medical Talk. Until we see you again, please stay safe and stay healthy.